Okay, so now we are looking at routes of elimination, or sometimes we say excretion of chemical. Main routes are renal excretion, so through urine, and biliary excretion. So this is liver processing of xenobiotics, of foreign compound, of drug compound, and later on it comes out as so. Now, this is not the only way. It's great. Volatiles will be exhaled from lungs. Saliva can give some level of excretion. Sweet can be significant way of excretion, especially when kidney do not work properly. Human milk can excrete some tears, while some xenobiotics will go into hair. Some will be simply deposited on outer layer of skin. But these are all minor routes if you compare to renal excretion. Before excretion, usually, but not always, drug undergoes metabolism, as we have seen. And after phase 2, you have glucuronate or acetate or glycine or sulfate or glutathione or simply methylated derivative. And this is how the compound is going through kidneys. So when we look at plasma concentration as a function of time, first what we show after IV injection is a rapid drop, which is coming from redistribution of drug from plasma into tissues, into volume. This redistribution doesn't end at several minutes, but the first step is very quick. Next step would be drug elimination, and this process is often first order process. As all main processes in human body, this is a first order reaction. If you remember, first order reaction can be plotted in log coordinates as a straight line versus time, and we have half-life, time that it takes to reduce the concentration by half. Again, just a reminder about first order kinetics. Rate of first order kinetics is proportional to concentration of reagent. Concentration is dropping down as exponent, and in a log scale, log of concentration drops down as a straight line. Half-life is related to rate constant. A larger rate constant, smaller half-life. Elimination kinetics of different compounds can be very different. For example, usually penicillin stays for very short time. Same as insulin, causing lots of problem for people with diabetes. Some other antibiotics like tetracycline stays for longer time. There are compounds that are staying for days, even weeks. For compounds like Tylenol, The possible poisoning and metabolism is so important and so well studied that we have special nomograms showing the amount of drug in bloodstream as a function of time. Here there is a scheme of a very complex processes that acetaminophen undergoes. It is glucurinated by OH group. It is sulfonated by OH group. And this is how it's removed by kidney. But it can also undergo oxidation, which makes a toxic compound. When you add in acetylcysteine, you have glutathione formation, and conjugate can be easily removed, so you are suppressing toxicity of extra dosage of acetaminophen in case of overdose. This is just one of example how this system works. So when drug comes into kidney, it filtered at renal glomerulus, secreted into proximal tubule, right here, can be reabsorbed from tubule and transported back to blood. This is what we usually do not want, and of course coming out with urine. It's obvious that if you remove urine quickly, reabsorption will be limited. This is a scheme of the same process. You have drugs coming into system, and this is an active process, and you can have passive reabsorption into bloodstream. Another process is related to liver. When drug is coming into bloodstream, coming into liver, metabolized here, coming back through bile duct into intestine, and can be reabsorbed back into bloodstream or going into colon, from where reabsorption is much lower. So drugs administered orally are first exposed to liver, and this is how they are extensively metabolized. So coming here to liver, and from here it's coming in bloodstream, not directly from intestines. pH of liquids, for body liquids, is also very important. This is just example how quickly nicotine is removed depending on urine pH. If we usually have a clearance of 100 ml per minute, then with acidic pH it dramatically increases, and with more basic pH of urine, it drops down. By changing urine pH, adding different benign compounds of acidic or basic nature, most commonly ammonium chloride as an acid or sodium bicarbonate as a base. We can change rate of clearance and remove toxins faster if we want. Half-life of different compounds is very important for their use. This is example for several different antibiotics. For example, anticycline has very short lifetime and cannot be used by oral admission, injection only, because it will decompose faster than it will be absorbed. More developed penicillins can stay longer, and modern antibiotics of the same nature, like ampicillin, have large half-lives of hydrolysis, so they can be orally admitted. They will not decompose. Kinetics of first order, as we already seen, can be described as one straight line, but most common you want to use two straight line in log scale, one for redistribution and second for elimination. You should carefully look at your data and see which one you want to use. Now, if you have very high concentrations of your compound, your first order kinetics becomes zero order for very simple reason. If you have very high S, K becoming too small, S and S cancel each other, and you're reaching maximum possible rate of elimination. That mostly depends on enzymes that metabolize your compound. If there is too much of compound, enzymes cannot work quick enough, and you have zero order kinetics, so rate of elimination does not depend on concentration anymore. That seldom happens. You need to have very high concentration of your poisonous compound, and usually high concentration will kill you sooner than any elimination occurs. So when it really happens, most common and famous case is blood alcohol elimination. A rate is zero order with speed of 0.015% of alcohol in blood per hour. It ranges from 100 to 200 depending on size of human body, age, some genetic, but cannot be faster than 0.025. We essentially do not have other examples of zero order kinetics. At very high concentrations, aspirin will show the same effect, but only at very high concentrations.